All right, hey everybody, Dr. Bulow here with another episode of Revive videos. These are videos that I do every week coming to you from my practice, Revive Upper Cervical Chiropractic in Cranberry Township, Pennsylvania, just north of Pittsburgh. All month long, we've been doing this hashtag Revive Chiro Kids, right? We want to talk to you about the importance of the spine as it relates to kids and yes, babies. So this past week, I've been talking about gummy bear babies, which is kind of a funny little, funny little thing to say, but let's talk about that for just a second. When you have a newborn, if you've ever held a newborn or seen a newborn baby, one of the things you realize is they have those little soft spots on the tops of their heads, right? The reason for these soft spots is that the head hasn't fully formed yet. It hasn't become bone, right? It's kind of like a gummy bear. It's pliable, it's movable, right? When a baby is first born, their bones are partially still rubber. They're partially still cartilage, like a gummy bear, right? Now I want you to think about a gummy bear. A gummy bear, if you held a gummy bear in your hand, you can squeeze that gummy bear. And you won't damage it if you do that. But if you take the gummy bear and you pull it apart, you can actually tear the gummy bear, right? Now, what does it have to do with babies? Babies are designed to be squeezed through the birth canal. They're not designed to be pulled through the birth canal, right? When a baby is born, those soft spots in their head are designed to squeeze the head through the birth canal. The soft bones and cartilage in their neck are designed to be pushed through the birth canal. But if the physician on the other side of the mom takes a hold of the head and pulls, especially with a cesarean section, forceps deliveries, vacuum extractions. Now granted, they're not going to cause a catastrophic damage in that moment, but can you see, it doesn't take much imagination to see how it can create some tissue damage, some damage to the supporting ligaments and tendons and joint capsules that hold the integrity of the neck and the spine and the baby's body together. And it's no wonder that some of these kids, many of these kids, don't nurse equally on both sides of the neck. It's not the mom's fault. It's not that they're not letting enough milk out of one breast or the other. It could be the fact that that child is just not comfortable in one laying position versus the other. Very often when you have a whiplash or you sprain your neck, you won't sleep on one side or the other because it hurts your neck. The same sort of thing can happen with a baby. They just can't tell you that, right? And one of the biggest problems is that when a baby is born, we as physicians, healthcare providers, they listen to the heart because the heart is a vital organ. Not because the child is having chest pains, right? But because the heart is really important. And we listen to the lungs of the baby, not because the baby is having an asthma attack, but because the lungs are really important. We want to make sure there's no fluid in the lungs, that they're full, etc., etc. But no one is checking the integrity, the connectivity, the swelling or edema of the spine. And the spine protects the little nerve endings. These are the same kids, by the way, that very often get colic and acid reflux, and they're spitting up their food. They're not keeping it down because their little tummies are so upset. And that can very often be due to the vagus nerve that calms the tummy down. Later on, if we don't get to the cause of the problem, they're the same kids that get ear infections. They're the same kids that develop bedwetting issues or headaches in grade school. Very often, if we trace it back, this is my encouragement to you, if you know a child that's dealing with these issues, how was their birth process? Were they pulled through the canal instead of being pushed? Remember, they're little gummy bear babies. It's okay to be pushed, but pulling can create some trouble. Okay? This is just an awareness. We want to provide awareness. If you know someone that maybe had a traumatic birth process or is dealing with these types of issues, I'd love to connect you with a very safe, responsible, knowledgeable upper cervical or pediatric chiropractor that can get in there and really take a look at these little babies' necks. These are our kids. This is our future generation. We want to take care of them. If you have any questions at all, please don't hesitate to ask. Feel free to share the video. You never know who is in your circle of influence that may need this kind of information. Otherwise, I really appreciate your time, and we'll talk to you next time. Bye now.